Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday, the 1st of September 2021. The COVID situation for us is that the numbers continue to rise steadily, and today we have 46 patients in hospital who are within 14 days of their first diagnosis. Of those, 4 are in critical care and 42 are on our general wards. We've also got an additional 14 patients who are beyond 14 days post first diagnosis. So that's a steady increase. Last week I reported 35 positive patients. We're up to 46, and the community numbers show a bit of an increase too. So Blackpool has gone up to 475 per 100,000 compared to 443 the week before. Fylde has stayed pretty level at 320, and in fairness Wyre has come down a little bit to 322 per 100,000. But anyway, our general perception is the numbers continue to rise, and of course we hope for a plateau and then maybe a decrease, but they still are of considerable concern. I'm afraid to announce another 6 deaths within 28 days of a first positive COVID test, and that takes the hospital total up to 785 since the pandemic began. So again, commiserations and condolences to the loved ones of those involved. What to say? Well, vaccination rates, adult population who've had both doses, 73% for Blackpool, 82% for Fylde, 82% for Wyre. The higher we can go, the safer. So if you've not had your second dose of the COVID vaccine and you're eligible to get it, then please do so. And of course the groups for first dose are changing, and you can book an appointment, get advice about that on the NHS UK website. The precise detail about younger age groups, of course, is being worked through, so we follow that on a weekly basis. And I'm sure if you're, for example, about to go back to school, you'll get advice through both the NHS website and also from school about that. GP practices are reaching out to particular patient groups as well. On the vaccination theme, I've said it before, if you're eligible for a flu vaccine, may I suggest you get that booked. We still haven't got the final details about the COVID booster programme. It'll probably align with the flu programme as well, but we need to get on and do the flu stuff, and we'll work the COVID in as we go. Self-testing is something I haven't picked up for a while. It's possible to get lateral flow tests for free from all pharmacies, and the public health recommendation is for adults to self-test twice a week, so that way you can really stay on top of your own situation, whether you have symptoms or not. Of course, if you do have symptoms, then the requirement is to have a PCR test still. That's the definitive test and allows us to test for new variants, and of course again that can be accessed through NHS Choices, NHS UK, or dialing 119. As the COVID numbers have gone up a little bit, we have been extraordinarily busy in the hospital generally, and I'm sorry to say we are experiencing long waits in our accident and emergency department, simply to do with demand and the fact that the hospital is really very busy internally. It's very busy with people coming to A&E, and it becomes a flow issue fundamentally. So may I ask again that if you have a problem that you consider to be urgent but not an emergency, then you see if you can get help and advice from locations other than our accident and emergency department. And of course that is a range from self-care through to advice from your pharmacy, accessing NHS 111 or accessing GP or primary care walk-in centres. So lastly, the same advice about us being careful still, looking after ourselves but also those around us, wearing masks in public places, really to protect others as much as ourselves. And if you do come to hospital where we still have visiting restrictions in place as these numbers rise, of course we will ask you to wear a mask as you come into hospital and abide by our infection prevention and control regulations. Thank you.